Welcome to our webinar. We'll be starting shortly, so just bear with us for a few minutes for a few more people to join.
We might make a start. My name's Adriana Tiziani. I'm the course coordinator of the Graduate Studies in Wound Care. Joining me will be Peter Tian, who's a unit coordinator for some of the units in the Graduate Studies in Wound Care, and Caroline Page, who is a current student. Just before we start, I'd like to acknowledge country. I wish to acknowledge the people of the Kulin Nations on whose land we are gathered today. I pay my respects to the elders, past and present. So, welcome. If you have any questions, could you please post them in the Q&A rather than the chat, and we will endeavour to answer the questions towards the end of the session. Okay, just a little bit of history to start. The studies in wound care have been going since 2000, and it initially started as a graduate certificate. In 2004, the graduate diploma and the master's was added. And in 2006, we graduated our first two master's students. We have subsequently graduated 92 students with the Master of Wound Care, 18 in semester 1 of this year. And there are many, many more who have graduated with either graduate certificates or graduate diplomas. Okay, so what is it about our course that's unique? There are a few things. It is flexible. In saying flexible, it means that you can organise your own time. Because the course is totally online, it means that you decide when you study. There are some online lectures, but you're not bound to attend lectures on a regular basis. There are assignments and they do have due dates, so flexible is not totally flexible, I guess is what I'm saying. As I said, the course is predominantly online. There is only one unit that has a face-to-face component, and that's optional. It's not actually a compulsory section of the course. It is evidence-based. It's very practical. We try and ensure that what we teach is current and clinical and involves wound care that you can use on a day-to-day basis. We try and ensure that any assessments that we do are case-based, and they are based on real case studies. So they are things that people will be familiar with in their practice. And hopefully from the course, you'll develop specialised skills and knowledge in wound care. One of the other unique features, I guess, of this course is that it's interdisciplinary. This means that you will be studying with other disciplines. So it's a mixture of nursing, podiatry, pharmacy, medicine, and occupational therapy. You can see that predominantly nurses, but you do get a mixture of other disciplines. And I think that's one of the richnesses of the course, is that it gives you an idea about working with other professionals within a multidisciplinary or an interdisciplinary team, which is really important as part of wound care to optimise healing. People come from all sorts of places. This is the cohort that we currently have, or that we had in semester one. So people were mainly from Victoria, and that's a mixture of metropolitan and rural people. This fluctuates from year to year. So some years we have lots of students from Western Australia and not as many from Queensland. You can see from this that this year we've got quite a few students from Queensland, and we do have a couple of students in New Zealand. We have some Singaporean students, and we have one girl currently in the United Arab Emirates. The entry requirements. So you need an Australian bachelor degree in pharmacy, podiatry, medicine, nursing, occupational therapy, or an equivalent. We do prefer our applicants to have 2 years of relevant clinical experience and professional registration. Or if it's a Division 1 nurse who is hospital trained, that they have 2 years of relevant work clinical experience. For international students, those located in Australia wishing to study this course must have professional registration to practice in Australia and have an appropriate visa to allow part-time study. All other international students are able to study, but it needs to be in the country where they are resident. They must also hold professional registration to practice in their country of residence. So, for example, our Singaporean students are all nurses, and they're all registered with the Singaporean Nursing Board. In terms of English requirements, we require a level D. So what does this course look like? So from 2024, the course, there are 3 entry points to the course. So you could potentially enter at graduate certificate level, or you could enter at graduate diploma level, or you could apply for the Master of Wound Care. This course is a nested course, and what that means is that you can progress on to the next level if you so choose. So, for example, if you completed the graduate certificate in wound care and you decided that you wanted to go on, as long as you meet the entry requirements, or the progression requirements, you can move on to the next stage. So you could potentially move on to the graduate diploma, and then you could move on to the master's. Alternatively, what you can do is take your graduate certificate and graduate, and maybe after a couple of years you decide that you want to come back. So there's nothing to stop you coming back and applying for the next level. Conversely, if you applied for and were accepted into the Master of Wound Care, and after completing the graduate certificate level you decided that really the course wasn't for you, or you had done as much as you really needed to do, you can take an alt exit. So you can take an alternative exit at either the graduate certificate or the graduate diploma level. So you can see that that also offers a degree of flexibility at either being able to move through the course in steps, or alternatively take alternate exits. Let me just tell you a bit more about the actual course itself. So the graduate certificate level is a 24 credit point degree. There are 4 core units, so there's no electives available at this level, and they're principles of wound care, wound assessment, wound management principles, and acute and chronic wounds. And that gives students a really firm background in wound care, and it gives you, it really scaffolds your learning to either progress, as I said, or to take what you've learned into the workplace. At graduate diploma level, which is 48 credit points, so it's those 4 core units at the graduate certificate level, plus evidence-based practice, which is a core, integrated wound care practice, which is also a core, and then you have the option at this level to do 12 credit points worth of electives. So you could either do 12 credit point units, or you can do a couple of 6 credit point units. So some of the electives that are available to you include introduction to epidemiology and biostatistics, and we'll mention that a bit further on because it actually relates to the part C of the course. Some students choose to do therapeutic medication management with a view to doing the nurse practitioner course. So that's that unit is a core unit in the nurse practitioner program. You can do diabetes foot, you can do pressure injury management, you can do burns and scar management, non-healing wounds and pain management. There's a unit called Foundations of Health Professionals Education. So if you're interested in becoming more involved from an education perspective, this is a really good unit. Or you can have up to 12 credit points of complementary units. So some students will do things like stomal therapy or lymphedema management, and they can apply for credit. So if you plan to do some of those courses and you think you might want to apply for credit, it's probably worth just double checking what we can give you as far as credit goes. The master, so at part C, or the master's level, so that's the graduate diploma plus. So you've got a choice here. You can either do the coursework stream, or you can do the coursework and research stream. So the coursework stream involves advanced clinical practice and clinical risk management and wound care. So those 2 units are core units, and you can also do another 12 credit points of electives. I'm going to hand the research stream discussion over to Peter Tian, who will be coordinating the research stream, and she will be able to give you more information. So thank you, Peter.
Thanks, Adriana. So as Adriana mentioned, I look after the research stream of the Master of Wound Care program, and I'll just outline what that looks like. So in the part B of the course, we ask that one of your electives be the Introduction to Epidemiology and Biostatistics, so the MPH 5020 that you can see circled there. So completing that course, or that unit, I should say, really sets you up nicely to undertake the final year, which is the research project. So in the final year of your study in the research stream, you undertake a research project. So the first semester, you essentially complete MAP 5000, which is a unit that where you plan your project. So you write your protocol, you prepare an ethics application if that's the type of research that you'll be doing. And then in MAP 5010, you then complete the project and write up your manuscript. And it's something that looks like what would be submitted to a journal. You meet regularly with a supervisor, so like myself or one of the other academics in the program on a regular basis, so weekly or every other week, and we help you through the process very, very closely. So we have had a number of people go through the research program over the years, and I just pulled out some of the interesting and like varying projects that we've seen. So we had Scott Jen, who's a podiatrist up in Queensland, look at a burn assessment tool for an outpatient setting. We had Sally James, who's a registered nurse and now works with us as one of our casual staff, looking at perceived barriers that prevent patients with lymphedema from continuing optimal skin care. We've also had Kitty Turner, another nurse, looking at evaluating the social dimension of a leg club. Amy Darville, another nurse, looking at education and management of skin integrity among spinal cord injured clients and their carers. Michelle Cornwall looked at showering and incisional wound 24 hours post-minor surgery and whether that affected the risk of infection. And then we had Rebecca Izali, a geriatrician from Victoria, who incorporated foot assessment in the comprehensive geriatric assessment. And she's published that paper and put it into her practice. So it's made a real impact in real life, which is what we are seeking to happen with these research projects. Just the next slide, thanks. So we have a number of very well-known people in the wound world here in Australia that have completed the Masters by Research, and they include people like Michelle Gibb and Robin Rayner, both of which went on to then complete PhDs in wound care and are real leaders in our space. Jan Rice, who's a nurse practitioner in wound care, and a number of other very well-regarded clinicians have completed the wound research stream. The research stream can really open doors into different avenues within your career as well. So you have that balance of coursework, but you also have this research qualification. So particularly if you work in a large hospital setting or a large organisation, you can move into more project work or research roles. It can also, as I mentioned, open up to potential for future PhDs, but also just more work in an academic setting. So it does open different doors maybe to if you were to just choose the coursework option as well. Just the next slide, thank you. All right, so I will just hand over now to Caroline Page, who is one of our students, to share with you her journey so far in the Master of Wound Care. So over to you, Caroline.
Thanks, Peter. Yeah, my name's Caroline Page. I am an occupational therapist, so I'm one of those 1%, 1%ers. So I currently work or have worked as an occupational therapist for almost 20 years, purely in the community, working mostly in a domiciliary service to start with up here in Queensland. And now I actually work for myself and have been working for myself for the past year. The reason I got into the Masters of Wound Care is that in 2014, I did the education and training to become a lymphedema therapist. So I did my level 1 training in 2014 and my level 2 in 2015. And I was fortunate to actually develop and establish a clinic at the domiciliary service that I worked for, and kept that clinic going for many years. And whereas that clinic started out with a lot of cancer-related lymphedema, it did sort of evolve, having been working in the community, to be a lot of more people with venous insufficiency and venous leg ulcers or lymphorrhea as a result of their lymphedema. So I worked alongside nurses, so there became more demand for my services for looking at compression and such. And I think through that, I realized that there is still, a lot more I could learn and contribute in the sphere of lymphedema. And so that's what really sort of encouraged me to look into doing the Masters of Wound Care. I commenced in 2020 and have been doing 1 unit per semester since. So as of, I think, next year, second semester next year, I'll be starting on the research, which for me, I was actually starting this course thinking I'd do the coursework stream, but just from my experience doing the course, it's built my confidence and my interest in the area to actually want to pursue the research stream. So that's something quite surprising for me, to think that I would have gone down that track, but I'm actually really looking forward to it. So I guess my experience as a student with Monash in this course is that I hadn't studied at uni for 20 years, or a bit less than 20 years when I started this course, apart from my lymphedema training. So having to do everything online and doing all of the library searching or journal article searching online was quite new to me. It was fantastic to have access to resources online, and particularly when you're working, it's just so good to have that information just available right in front of you. So that was really a big learning curve for me and a big bonus, I guess. But it was daunting because I had to relearn some skills that I think I felt that I had forgotten. And the first semester is that baptism by fire type semester. Or unit, which is the principle of wound healing, I believe. And look, it was a tricky unit to start with, and I think that everyone acknowledges that. But once you get into it, it's actually it gives you that really good foundational skills for the rest of the course. And as Adriana said, the course is very flexible. There is a lot of learning materials and resources to access to further develop your learning. It is self-paced, so you do have to have a bit of discipline. So you have to really work on your time management skills, but then having the course set deadlines with assessments and such, it really helps as well. So fitting it into your work life can be a struggle at times, but I think once you get into the swing of things, I'm just about to finish my 7th unit, and I feel much more relaxed in how I approach assignments, how I pace myself, and so that the learning experience has certainly improved considerably over the years. And plus you get big breaks over Christmas and middle of the year anyway to recover if you have had a frantic year. But it is very flexibly offered, which I liked. And I also I totally agree about the scaffolded approach. Starting out, I didn't really know a heap about wounds. Being an occupational therapist, I had a really good, I suppose, anatomy and physiology background, but not a lot in wounds. And so I really felt that I had to put that effort in to gain that knowledge. And after having done seven units, I really feel quite confident from what I've learned so far. So it really does help you to learn a lot in this area. I also quite like the assessment variety. So there is sort of those knowledge acquiring assessments, the case studies. There's a couple of presentations, but they're really good to do, a lot of sharing of information there and a lot of practical components, which I think as adults, we like that learning style where we can learn by doing, I suppose. And I also like the fact that I can learn something through the course and apply it in my everyday life. And that really helps the learning. And really it consolidates what you're learning through the course. The unit advisors and the teaching staff are all very approachable, so that's always been very good. If you ever have any questions, you know, they're more than happy to answer those, so you feel that support. And also there's usually lots of discussion forums in most of the subjects, so there's a lot of talking with other students through those discussion forums, which is really good. So I quite liked, I have liked that very much. So yeah, that's probably my you know, I suppose my main points. And I guess, you know, moving forward from this, it's really inspired me to see how wound care can be I suppose a bit more prevalent in the occupational therapy world, because I think occupational therapists do have a lot to play in the wound care world. And so I'd like to see more OTs taking up this course. But certainly it's been really good working with, you know, predominantly the nurses, but podiatrists and pharmacists. I think there was a GP once on one of my courses. So it's really good to get everybody's perspective, and it really feels like it's that really integrated learning experience. So yeah, so I think that's probably my experience. I've enjoyed it, and I've got a few more units to go, and you know, I look forward to reaching the end. I think there'll be a bit of sadness there, but also maybe some weekends free again.
Thank you, Carolyn. I mean, this is I guess going to sound like a negative question, but what has been the hardest part of studying, do you think? What have you found the hardest?
The hardest part, I guess, look, online is challenging, I guess, because there is a lot of reading. But one thing, and you know, I know when I did my undergrad studies, you'd see me with a textbook, and then I'd get about 10, 20 minutes in, then I'd be snoozing because it just gets so mentally fatiguing. So there is a lot of, I guess, a lot of reading material. But one thing I found that seemed to progress the more across the units that I've done is that I've actually then become more inspired to look for my own learnings from the reading. So it's like, okay, I'm reading this stuff, but then I'll go away and I'll listen to podcasts or watch YouTube videos or find other things that will actually help consolidate that information from the notes. So I think the hardest part was, I guess, getting into that reading and trying to digest the information from reading. But then when I started to throw in other ways to learn, then it certainly helped. But then as this course goes on, there are a lot more practical components to it. So that's really interesting. And look, when I was in undergrad, I wasn't a big fan of case studies because I hadn't been out there in the world, you know, seeing real people. So case studies were just these theoretical people. But when you're working and you're doing a postgraduate course, the case studies are really interesting, and they really do help you to understand the material and put it into practice, and also be able to transfer those knowledge and skills over to your real life practice. So the case studies have been really helpful. So yeah. So I'm sorry, I've turned that negative into a positive. So
that's all right. That's all right. Thank you. That's great. And I think that's just about us. So if you've got any further questions, you can certainly direct them to me in the first instance, and I can put you on to someone else if I don't have the answers. Thank you for your time. I'm not sure whether we've got any questions. Karen, have we got any questions?
No, we don't have any specific questions, but I did want to raise a question that Caroline mentioned, and that is the examples of practical cases that you're doing and how that works. That was really interesting to hear about when you're doing practical areas.
Yep. Okay. Would you like me to answer that? Yep.
Yeah, go for it, Karen.
So this semester I'm doing the integrated wound care. So there's a lot of activities. It's quite a self-directed course, this one. So there's quite a few assessment items, but really interesting. I was really surprised at how I could say I've got like a number of assessments that I'm actually really excited to do. And a couple of them being that we have to actually do videos of us conducting a lower leg assessment and doing Dopplers and things, or an ABPI on a patient or somebody, a subject. And the other one is compression bandaging and doing a video on that. So it's one of those things where, you know, I guess it helps you to really try and practice the art before, you know, because you're submitting a video as part of your assessment, so you want it to you know, be accurate and be good. So it's just gives you that opportunity to do something. It's sort of learning in practice. So that's part's been good, and have, you know, we also did a presentation, case study presentation, which I must admit I have always loved doing, but I know a lot of people don't like doing those, but those kind of things have been good. And there was a clinic observation as well this semester, this unit, where we you know, have the opportunity to go to a wound clinic and observe and write a report about that. So that was really interesting as well, because it can, you know, feel very siloed, I guess, when you're doing your studies, to be able to get out there and experience it in the real world.
That's excellent. Now, I think we actually have a question. I don't know if someone wants to type an answer or you want to answer it live, but it's just a difference in the cost structure between starting in a certificate or diploma or master's.
I can answer that if you like. There is no difference. So everybody starts at the same point. So whether you enroll in the graduate certificate, the graduate diploma, or the master's, everybody starts at part A, which is the graduate certificate level. So you would all do the same 4 core units, and then move on. So there really isn't any difference in terms of starting points.
Excellent. And it does sound like it's very flexible, as you've mentioned, so that's good. We have another question. What is the career pathway of each course in nursing?
Oh, okay. Well, how long's a piece of string is kind of the answer to that. Look, there's a number of pathway, I guess career pathways. It depends very much on where you are located or where you see yourself going. So some of our students have become clinical nurse specialists in hospitals. They have gone on to do nurse practitioner courses. They work in wound clinics as part of multidisciplinary or interdisciplinary teams. Some of them work in nurse-led clinics. Some of our students work in general practice as practice nurses, with wound care as their main area of expertise. We have a number of community-based nurses. So there are, and aged care, I shouldn't leave aged care out. There are quite a number of aged care nurses who are doing this course, and they often end up with the wound as their portfolio within the nursing, within the residential aged care facility. that can happen on wards too. Some people work on acute wards, surgical wards, and they have the wound care portfolio. So there are lots of opportunities, I guess, to use wound care, but really at the end of the day, wound care is a basic part of nursing anyway, and anything you can do to optimize a person's healing is a good thing. Is there
I might just add to that one as well, because what we see is a lot of nurses complete this course and then are successful in obtaining either CNC or CNS roles within their setting. And then we've also had other nurses in particular go on to establish businesses where they either do education or a mix of education and consulting work in wounds, either to aged care or different providers as well. So there's also sort of your non-traditional sort of roles as well that some nurses take. Yeah.
Thank you.
I noticed another question, if you want to answer this. We did cover a little bit in the presentation, but it just asked more specifically about what types of weeks people need to be at Monash. I think that's the unit that's not a compulsory unit, but if you could maybe clarify a little bit on that.
Yeah, the unit itself is a core unit, so it is a compulsory unit. The bit that's not compulsory is you can choose to either do the unit totally online, or you can choose to do a flexible mode, which means that there will be a 3-day workshop located in Melbourne at Clayton. Next year it will be in November, and I suspect that it will probably be in November from here on end. So I guess what we're trying to do is, again, it's that flexibility. Some people are able and want to come to Melbourne. Other people have commitments that mean they can't really travel for a whole lot of reasons, but it does mean that they can actually continue through the course and not be held up because of the on-campus component being compulsory.
Excellent. Okay. Did you want to add anything else to what we've discussed, or is this a point where we will finalize the webinar?
I don't have anything else to add. Carolyn, have you got anything to add?
No, not particularly, but just to, I guess, in summary, that I have really enjoyed this course, and I think given that the future, you know, with the aging society that we have, that, you know, there's going to be a tsunami of wounds that we're going to be experiencing in the future, and having worked in community for 20 years, I've actually seen the ability to provide good wound care in the home has actually declined. So I think there's huge scope for, you know, for people to have great careers in it in the future. And certainly I think it will come to the forefront of government funding minds to increase, you know, support in that area. So, you know, I guess that we just need more people out there with a passion for wounds.
Peter, have you got any final words?
I agree with Caroline. I think the more people that can be armed with really good knowledge to influence their care of patients in need can only be a good thing. So we hope to see some of you next year in our course. So we look forward to welcoming you.
Thank you.
That's fantastic. We've covered quite a few aspects and some good questions. So, and there is one final question on which options to take. So maybe there might be a little bit of a discussion about that.
Options.
Yeah, I think it might just be in terms of electives.
Well, I guess you could interpret that question one of two ways. Either options in terms of, do I start with the graduate certificate and dip my toes in the water and and then decide to move on, which is what quite a lot of people do. And in terms of electives, I guess it's about what are you interested in, and what would be most useful to you in your workplace. And that tends to be the kind of reasons that I think people choose their electives. What will give them something else in their toolbox of wound care that they can bring to the party. So I hope that's answered the option question.
No, I think you've answered all the questions very well. So I think at this point, with no other questions, we'll say thank you to everyone for your time. I think it's been very insightful, and it'll give people a chance to understand more about the course. So thank you. And now this ends our presentation. Thank you all for being part of our presentation tonight.